So we're going to get started. We will try to cover as many of the frequently asked questions during our presentation. So please pay attention if you don't hear your questions answered or concerns answered. You can circle back on the Q&A tab and basically ask us. And we will cover as many as questions as we can during the presentation. If not, please circle back and ask us for your issues or questions. A little bit about myself. I've been in the medical tourism industry, specifically in Mexico, from 2007. I launched Mexico Bariatric Center in 2012. We are a US-based company. We've done 30,000 successful surgeries since inception. And I started the Hospital Ozar project in 2021. And finally, we opened our doors to our patients, to our medical tourists in 2024. And it's about 1.5 years. Hospital Ozar has given us so much more capability of offering top quality services and additional services. Right now, we have skincare, stem cell. We are offering always new procedures like SASI, bipartition. We did start doing gynecology like endometriosis, hysterectomy. We can actually do combination, what we call combo procedures like sleeve with hysterectomy, knee replacement, and like I mentioned, for anti-aging, well-being, knee, shoulder, with the regenerative medicine. Our website, Mexico Bariatric Center, has always new material, is full of information. I suggest you read about the procedures, not from just MBC, from everywhere, from YouTube. Just be educated, because education is huge for your success. Educated patients have higher success rate, and we always have been in the forefront of this. We have, hello. Actually, I have Dr. Rodriguez joining me here. Let me, there we go. So maybe we can go to yes. Hello. Let me see if we can unblur the background. And yeah, how are you?
Morning. How you doing, everyone?
So I have a pleasure to actually this time do it together with you.
Yes.
And yeah. So basically, we just actually had our sign of the hospital outside, which was exciting. We passed our 1 year, celebrated the hospital opening. We are basically offering packages now, travel packages to all patients across the world, from Canada, New Zealand.
Hi, my name's Lee. I'm from New Zealand. I've had the best experience ever. From the start, the whole team, right down to drivers, everyone, doctors, nurses, you name it, have all been so supportive and very happy, very friendly, very kind, very empathetic. I've had no complications. I've got no pain. I'm walking around a lot. Not very hungry. The ice chips are wonderful. So, I recommend anyone who's thinking about it to, 100%, don't hesitate, come over. It's worth it. Financially, it's worth it. It's worth it in so many aspects. And I think I'd like to come back and just do a little bit more discovery of Tijuana and San Diego. So yeah, thank you, team here at NBC. It's great.
Thank you for
Again. Yeah, no, good. Really good.
Remember, next year, catch us in August and November.
Yes. I'll be back for skin removal. They
Okay.
say about 2
We'll
years,
see
2
you in
years.
New Zealand.
You will.
Okay.
Thank you so
Thank you.
much. Bye.
And I just came back from New Zealand. The topics we're going to cover today basically is, like I mentioned, education on outcomes, the complications, what you should expect after surgery, what is the complication rate. That's huge for you to be successful. And we're going to talk about obesity, how to calculate your weight loss, what would be your goal weight, your ideal weight, and what does weight loss surgery do for you, which we call it metabolic reset. And we will talk about why you should choose NBC and the support programs we have for you. And Dr. Rodriguez will be taking over and talking about all the bariatric options we offer. We would touch base on financing and nutrition program, and then we would try to answer your questions, as many as we can. The raffle will be at the end of our presentation. We all know what obesity is. Basically, our lifestyle, lack of physical activity day to day. You just have to remove this. What can you do? Battery? There you go. Okay. So you just have one?
Yes.
Oh, okay, you already.
I already have one.
Okay, so we're gonna try this. See,
Let's check
what
if
we have to,
if they are listening. Yes.
Okay. Usually it should come up here.
Can you listen us?
I think it's connected. Because I see this one, see it says microphone is used by Zoom meeting.
Can somebody tell us if you are listening?
Yeah, let me check with the office here. Let's do this.
So I want to tell a story. We have a lot of registered nurses that are coming with us, and at the moment they met the hospital, they know that they are in a high quality hospital. At the moment they arrive, they look the amenities, they look the equipment, they look the human part of the hospital, that they understand they are in the right place. So that is something really, really important. Here in NBC Hospital, Assad Hospital, we only do bariatrics. We are experts in weight loss surgery, and it represents the 20 years of expertise of the NBC team, all the nurses, all the medical team, all the logistic team is experts doing this. So at the moment you arrive to the hospital, you will feel that you are in the right place.
Of course, not to mention the amount of expertise we have, like surgeons like yourself. We always call you a super surgeon.
Oh, thank you.
For a reason.
Yes. So if you are doing a surgery, you have to check for the best of the surgeons of the hospital, because it is your life. So we know that, we take care of that. At the moment you are here, we're gonna take good care of you, and safety is gonna be our priority. So you will see at the moment you arrive here that you are in the correct place.
So what would you say the steps you take as far as safety? You were telling me yesterday about the staples you use, for example?
Yes, there are different brands of stapling. Stapling are the instrument that we use to cut and seal your stomach, the small bowel. It is a medical technology, but there are different brands, and the quality are different. In the quality is something really, really important because it's gonna stay there forever. The stapling is something that is gonna stay there forever. So if we choose the best quality, we're gonna have the best results. And we always use high technology, reinforced technology. So that is something that you must know because at the moment you use the correct equipment, you're gonna have good results. So that's something really, really important for us.
I think the capability of surgeons like yourself being able to offer anything from endoscopic to laparoscopic, not only you're not limited by performing gastric sleeve at a low BMI. You've done a BMI of over 110.
Yes, yes.
And so there is no limitation what you can perform.
Well, first of all, we need to understand 100% the obesity. If you understand obesity, obesity has it's a complex situation, and if you understand everything, you're gonna be an expert. So that's why here in the company we can do all the weight loss procedures because we understand the disease. If you understand the disease, you're gonna understand how to treat the disease. So that's why because we are really disciplined in the academic part. We have the expertise to control all the scenarios. We know what we doing. This is not something new for us. We have the correct training to be able to perform this. So it's because we understand what we are doing. So we control everything. That's why we can do all the procedures.
You know, I always mention this example. I say, when you want to go buy a jacket and we go to the store, let's say you need a large or extra large jacket and they only have medium, they're going to try to fit that medium on you. But we don't have any limitation as far as what we can offer. Our goal, your goal is to give the patients the best option for them.
Exactly.
Not because we want to take their money and do a surgery.
Yes, because an example, if you are looking for a weight loss surgery and the surgeon tell you that you only need a gastric sleeve, but you already know that the gastric sleeve is not gonna be the best option, and the surgeon is telling you the gastric sleeve is gonna be correct, that is not true. So why? Because if you understand the disease, you will know that you must have all the treatment in your hands, and you will give the patient what they need, not what you can do. So that is totally different. So here in the company, we have all the treatments of the disease that we are treating because that is our responsibility to know. That's the expertise.
Correct.
That's the expertise.
Because
No
that
limitation.
expertise is giving us the option to not try to sell something to somebody, which is not fair.
Exactly.
It's funny because we have some of our past patients who actually work with us now. They came first to us for doing lipo or plastics. And they thought that with the lipo, they're going to lose weight. We told them no. We are very strict about the BMI, how we give patients plastics or not. We send them to the MBC side. They got the surgery, they lost weight, and then they got mommy makeover or lipo, and they look great.
Exactly.
And we see this over and over, even in the United States, when people with a BMI of 40, 35, they go and they get tummy tuck. A few more years, they need a weight loss.
Yes, exactly.
So we are doing this on an ethical basis. And what gives us this option because of the expertise like surgeons like yourself.
And we have all the tools here. We have all the tools. We have endoscopic, laparoscopic, and also we're always trying to be in continue the new technologies. We are going to do magnets. We're going to do robotics in the future. So in medicine, everything changed every year. So we need to be updating everything. And here in the company, we are really, for us, it's really important about that. We need to be, we have to be the correct surgery for what the patient needs.
I know you're very humble as a surgeon, as a person, but maybe you want to tell us about all your accomplishments. You're one of the top surgeons in the world that you've done SATI or DS, and tell us about like all you're basically a professor of this field. So why don't you tell us a little bit about the congresses you're invited to?
Well,
accomplishments you've done.
when we start doing, do you remember, we have 10 years doing surgeries here as a team in NBC. At the beginning, when the patients gave us the health questionnaire, and we understand that though that patient needs duodenal switch, we're not going to offer a gastric sleeve. They need duodenal switch, so we're going to give them the duodenal switch. We start doing all the surgeries, and after probably 3 or 5 years doing all kinds of surgeries, all another surgeons wanted to get inside of our surgery rooms, and they look what we were doing, and they say, "Wow, you are in another moment. So can you share what are you doing to us?" And I'm talking about the ASMBS, that is the American Association of Weight Loss Surgery, the Mexican Association of College of Surgeons, and the Worldwide Association of Weight Loss Surgery, the IPSO. So from 6 years ago, I'm professor of those college. That is something that I feel really, really glad to be part of that. And we always teaching, sharing our expertise. That is something that we have to do, because that's part of the medicine. We have to share what we're doing because we have really, really good results. Our numbers are the best of the world. Our complications are really, really low, are lower than statistics in worldwide. So it's
well, something to be said about our complication, right? Because first of all, you guys are dealing with a population of patients that have comorbidities from blood pressure, high blood pressure, from diabetes,
heart disease.
I know you're one of the top surgeons as far as approval. You take a lot of the cases that they won't even touch in the US, not to mention all the revisional surgeries you do, all the complicated, complex procedures you do. Considering all that you do, all we do here, our complication rates are less than 1%. That is a great statistics.
Yes, I have doctors, surgeons as a patient. And when they see what we are doing, when they see that the way we understand the disease, all the equipment that we have, all the heart, the lungs, protections that we do to our patients, they understand that they are in the correct place, because when another surgeons from America are coming as a patient, that's something important. We have a lot of registered nurses that are coming every day to the company to have surgery, because we're doing the things the correct way, or the best way it could be, and always improving everything to give you the best treatment for you.
Yeah, I mean, the amount of expertise we have with you guys, the surgical teams we have. I hear, every surgeon that has visited our hospital, they have said that we have the top installations of all Tijuana, or sterilization, all that we did in the hospital. The experience that the patients have, I just pulled the curtain, but this is every room has a view of outside. This hospital is a game changer for us. because of the neatness, the experience that the patients have, which added to the surgical expertise that you guys bring.
Exactly.
And I don't think, honestly, any company in the world have this much
No.
expertise.
Nope, nope. We are 5 teams in doing weight loss surgery. We have plastic surgeons having a lot of expertise after weight loss. So we only do weight loss patients every day since 10 years ago. So expertise is really, really, really high. All the surgeons in the company are experts, all of them. We choose, not everyone, not a normal surgeon is here, to be honest. We choose the best of the best. And that's why the quality is in the top of the world.
And I want to maybe touch base on the process that we actually take patients, right? So first of all, over years, because of so many health questionnaires that we have processed, and because we are a technology company at the end of the day, we have developed complex routines. When you submit your health questionnaire, your health history, we match you with the best surgeons for you. And we have different surgeons offering different procedures, different capabilities. Of course, you know, Dr. Rodriguez is our top gun. He's our super surgeon, but all surgeons bring a certain type of expertise. That's why we can handle all we can handle. And remember, we have a surgeon liaison. She's actually a doctor that graduated from Guadalajara. Jenny is a great
She's the best.
tool for us, right? She's sitting in there. She's so smart and she's so educated and she's been with us 10 years.
And she is expert. She knows more than a normal doctor, a normal bariatric surgeon. She knows more. Her expertise is in another level. So at the moment, I have a patient from Jen. I know she's doing the things correct. So yes, all the team from the beginning to the end of the system, of the process, of the journey is experts, drivers, coordinators, nurses in the hotel. You're gonna be we're gonna take good care of you in the whole process of this journey. So that is something that it represents a solid company, responsibility of the company, and because we love what we do. So we want to take care of our patients that are putting their lives in our hands. So, yes, that's
They
what
trust us.
yeah. So
Yeah, they come from all over the world and we really appreciate that.
yes, from America, Canada, New Zealand. We have patients from France, from England. It's amazing. It's amazing how all around the world are coming to here to have a safety weight loss surgery.
Actually, that's another thing. I was going to touch base on ideal weight, you know, the BMI and stuff. And then this is a survey from our patients because, you know, in the literature, for example, they say, well, with the gastric sleeve, you lose 65 to 75%, or those are just the average numbers. But we see our patients losing all the weight they want. We have patients with the gastric sleeve that they have lost 350 pounds.
Yes.
I mean, this is because of your guys' expertise. It's not like, okay, this is how you perform a gastric sleeve, but isn't your experience the way you actually do the sleep comes to play as far as low complication and high results, high success rate?
Exactly. At the moment we see the health questionnaire, at the moment we met the patient, we know what is gonna be the best procedure for the patients, because everybody needs different tools. The surgery is a tool, and we need to understand first what is the tool that you will need to have success, because everybody's different. Everybody's looking for a weight goal. Another patients are looking for quality of life. Another patients are trying to control the diabetes. the glucose levels. So everybody's different. So that's why we have different tools for you. And expertise means what is the best procedure, the best tool for you. So we know that that's when we understand that, we're gonna have the best results. So, and everybody needs a different tool. Everybody.
Even like with, for example, with gastric sleeve, our average weight loss is way above what is published. Our complication is way below what is published, and our success rate is high. And because of your expertise, you've done what, over 6,000, 7,000 surgery? I don't know
Yeah.
how many. It's beyond, you know.
Yes, a normal surgeon probably do 1,000 in the life, a surgeon life. We are well in the last meeting, we did a research about the duodenal switch. I have 2,350 cases.
Wow.
The second, that is the other surgeon that was in the second place, has 300 procedures. So
Amazing.
yes, it's really we are separate from the normal surgeons. So
And here's something, because you do this every day.
every day.
You're in the OR every day doing the same thing. This is your skill, your practice, because you're not doing one general surgery and one something else. And this is what you dedicated to do, this type of surgery day in, day out.
Every day. It's normal. It's normal.
Isn't that what the best surgeons are doing? Just doing the surgery.
Exactly.
You're not distracted by some other factors, or not having a surgery one day. Every day you're doing the same practice.
Exactly.
So that's what makes actually that's a good, only 5% of our patients need revisional surgery.
Wow.
Because in the literature it's 15%. Imagine, because again, these all go back to, because you guys do the best. First of all, you offer the best option for them, and you do that option the best.
And also for results, we need to talk about the diet treatment, nutrition treatment, and also our nutrition is experts doing this. The way she give the information, the diets, she knows everything in sleeve, she knows everything in bypass, she knows everything in duodenal switch, in endoscopic procedures. So if we mix surgery, diet, that's why we have a better results, because it's a bariatric nutritionist and she understands everything related to weight loss surgery, and that's why we have better results.
Well, I touched base again. This is like the few times I mentioned, educated patients make the best patients, right?
Yes.
And we are very transparent. We don't tell them, hey, this is you're not coming to Disneyland, right? This is a surgery. It has to be taken seriously, but we do it the best, right? And we also mentioned about the complication rate. We also mentioned about what you should expect outcome. All these I started actually going to seminars back in 2015. We went to Texas first. We've been going all over the world. And since after COVID, we just started doing this. And be educating patients. We're telling them this is what surgery does for you, and this is what MBC.
Exactly. It's a big responsibility for us, but also a responsibility from the patient. To have success, we need both things. So to do a correct surgery and to follow the instructions, to do a life-changing habits treatment.
Yes.
That is
Yes, that's a good point.
but with the correct tool. And the
Yes.
surgery is going to be the tool.
Is a tool, but they still have to. And actually, I should give I should give credit to our patients, to the researchers. That's why they find us. They do a good job. Like you said, a lot of them are in the healthcare industry. So they're nurses, they know like what they're getting into, right?
and they know how to change their lives with the diet, the lifestyle to get the best results.
Exactly.
So that actually adds to what we're doing, right? We want to educate the patient.
Yes, yes.
Maybe you want to just touch base real quick
About the
on-
gastric, okay, yes.
Yes, and then
So, can we move?
yeah, sure.
So I'm gonna start with the gastric sleeve. Probably, gastric sleeve is the most common surgery that we perform. The gastric sleeve is a surgery that is done in the stomach. The stomach is the part of the body that controls the hunger, that controls the restriction, that is gonna give you information to the brain that it's in the enough the amount of food that you need. So we work on this. The gastric sleeve, we remove the 70, the 80, the 85%. It will depend on the size of the patient's stomach. But at the moment we remove that part of the stomach that produce a hormone, hunger hormone, are gonna give you a big tool to make this possible. And also, if you feel full with small amounts of food, the signal of your brain of society is gonna start, and you're gonna feel more comfortable to make the diet happens. So what is a gastric sleeve? A gastric sleeve, we have to cut and remove a part of your stomach to make the stomach smaller. So we have here the numbers. This procedure, we do restriction to limit food intake, change the gut hormones that cause hunger in satiety, and slows the gastrics empty.
So maybe this is a good subject, right? Because before in years ago, they didn't know exactly maybe the restriction is the hunger hormone, but now they found out that there's so many hormonal changes. And actually, maybe this would have been a good discussion to have here, talking about the GLP-1 medications like semaglutide, GLP-1, Ozempic, Mounjaro, all that. So let's talk about some of that, right?
Yes, the brain is connected to the gut, and it communicates by hormones. Okay, at the moment the food gets inside of the digestive system, the digestive system is gonna give information to the brain, and they need the hormones to make that communication. Okay, it's the messengers of communication between the gut and the brain. And you can find in if you want to learn more about this, the second brain. They say that is the second brain, but because there is a lot of communication. So at the moment that the food get inside of the digestive system, it's gonna give signals to the brain. So that is the part of the medication that are working. But something that I don't like about the medication is that we are giving signals without food. That is the problem of the medication. That's why there are a lot of symptoms. There are a lot of complications. Right now, they are giving issues in pancreas. So that is because they are touching the hormonal communication, but without food. That is a problem. That is a mistake that we have to understand. That is not the normal way. You must have food to start the signal. And with the shot of this medication, you're gonna start the signal with that food. That's why that is the problem. That is the problem. That is, we have a lot of patients that are coming back from GLP treatment. I believe that is the reason that they're not working.
I think this is great, but I think the biggest problem is because they're advertising it like a jump start, or they're saying this, well, you lose weight and then maybe you can get off. This is once you start getting GP1, you need to continue it for life. It's not something, oh, okay, I'm gonna take it 6 months or a year and a half and lose weight for my wedding or something like that. And then you say, okay, now I can get off. Because once you get off, right, the food chatter and your brain gets louder,
Exactly.
you're gonna gain 4 times more than you lost. This is a statistic just came.
Yes, because you touch the hormonal pattern of signal, and that's nature. You it's hard to manipulate
Yes.
that part of the body that is something in the deep part of the body. So hunger is it's a part of the body that is designed for surviving, and if you manipulate that, something's gonna happen.
Yes.
So at the moment they take out those medication, all the hormonal cycles are different. So that's why they're having a lot of issues about that. Regain is at the moment you stop medication, the 80% of the patients will regain. If you talk about price, with 1.5 years of shots, you're gonna pay the surgery. It's the same cost of the surgery. So, but it's I'm not saying it is bad, but probably it's not the best tool for long-term weight loss results.
It's not a long-term.
And we want a long-term results because we want to improve the quality of life forever. So
I mean, basically, as you see on the right side of the screen, there are so many hormones change naturally as a result of the bariatric surgery, and you get the restriction.
yes,
Is a physical, like you mentioned, is a natural
natural.
way.
Yes.
When they're trying to do with the synthetic hormones, simulate some of the effects of bariatric surgery.
Yes. So
Okay, I let you continue here. I mean, again, as you see, I mean, this is a great medication.
yes, yes,
It's a breakthrough,
yes, exactly.
but it has its own place. Now, it's not for everyone, as you see in this pyramid, right? Can everybody with the diet and exercise lose weight and keep it off? Maybe very small. And
Yes.
also depends on your BMI, how far out you've been on that high weight, right? So your brain, your body is used to that set rate.
Yes, the diet and exercise is gonna be the treatment for weight loss. You always need diet and exercise,
Yes.
but without a tool, it's really, really difficult because let's make an example. Some patients can have a neighbor, a friend that eat a lot. They don't do a lot of exercise, and they are not with obesity. And a lot of our patients tell us that they don't eat a lot. They do exercise, and they don't lose weight. What is going on? This is because the metabolic issues, the metabolic part of the obesity. There's a part in the body that you cannot control, that is happening in your inside of your body, but you do not control. So you need a tool to change that metabolic part. The treatment is going to be diet and exercise, but you need a tool to make this happen. The medication is one of those tools. Then we have the endoscopic procedures when you have, because everybody needs different tools. The medication is like a small tool. The endoscopic procedures are the middle tool, and the weight loss surgery is a big tool, the most powerful
It's a
tool.
gold standard.
Exactly. So that's why we promote the surgery, because we know with the surgery, success is higher versus other procedures. So, but there are some patients that only need a little push. Like that could be the endoscopic procedure or also the medication. I don't know, but that's why it's really important to send us the health questionnaire, your history of related to diet or struggling with obesity, because that is important to know to give you the best tool.
You know, I see a lot of patients have hesitation. Well, some people think, well, weight loss surgery is cheating, or they're not really committed. They're not sure, do I want to do this or not? What do you have to say about those patients that are on the fence? They really need this procedure, but also they're not committed and they're not decided to do this yet.
Well, to have surgery is hard because it's invasive.
Yes.
It's everything is control. It's a medical control treatment, but I understand it is invasive. But the quality of life that you're losing because of obesity, all the disease, all the medication that patients can use with obesity, it's hard. It's difficult to be sick a lot of years of your life, to always struggle with disease. 5 years, 10 years, 20 years. We have patients with obesity since they are kids. So I know because I do this every day that there's things that you cannot control.
Well, like you mentioned, obesity now is called a metabolic disease.
Yes,
Like you mentioned, inside your body, you have a metabolic system that is not working like.
exactly. It's not working. It's not your fault.
Yeah.
You are the responsible, but not everything it is your fault because
No.
at the moment you try to do diets, the
Yes.
first day is okay. The second day, it's harder. But after 3 days of diet, you have headache. You see the food, you smell the food, you have cravings, and the demons inside of your brain start to tell you go back to your past habits, and it's really difficult to be fighting with your brain because it is your brain, but also is your body that is telling you that is something wrong happening in your inside of your body. That's why we need a tool to control the metabolic part, and then we go with diet and exercise. That is your responsibility to change your habits. It's part of your responsibility, and when we do this together, that is the success because. With the surgery, we give you a tool to control your metabolic, to control that part that you cannot control. But we can do it with the surgery. And then if we add all the habits that you have to do about talking about diet and exercise, that is the success. Because you cannot control everything.
You know, we hear that often, that one of their regrets after surgery is why didn't I do this earlier?
Exactly.
We hear that time and time again. Say, what's your regret? I didn't do this.
We have patients that it's not only the disease that can get pregnant
Yes.
because they have PCOS and
Yes,
they
we're gonna
cannot.
touch base on that.
Yes, because that's something important. A lot of our patients want to be parents, and they can't because they're having metabolic hormonal issues. And to be able to have pregnancy, you need to have control of your hormonal because it's important, the hormonal part in pregnancy. So at the moment we do surgery, they can spend 3 years doing a lot of treatments, but the moment we do surgery in 5 months, they can get pregnant. That's amazing. That is because we changed the metabolic part. That is, I think it's almost impossible we do it with diet and exercise. We need a tool to change that, to make that happen. And that is the surgery.
Yeah, surgery actually resets your metabolic system, like I mentioned. Yeah, let's go back to so we can cover all the different surgeries. Maybe we can just touch base quick on it, just like explain very little, like what each procedure look like. So yeah,
Well, there's we talk about the gastric sleeve that the surgery is in the stomach. We have to do 4 or 5 incisions, but we can do it everything through the belly. What is the difference? Aesthetic. Some patients don't want to have incisions, so we can do it or everything through the belly. There's another gastric sleeve, but the endoscopy sleeve, we don't cut. We do stitches. It is a surgery, but we do it everything through the mouth. We have to introduce an endoscope, get inside of your stomach, put some stitches. We don't cut. This procedure works not letting your stomach to stretch at the moment you eat. So the results are not the same as a traditional gastric sleeve, but if you don't want surgery, incisions, this could be an option. The gastric bypass. The gastric bypass is the gold standard in weight loss surgery. The gastric bypass has 70 years in the bariatric fields. So the gastric bypass, it's a more powerful tool than the gastric sleeve. Patients that the BMI is higher, patients that have metabolic disease. At the moment, we use the small bowel to do surgery. We are talking in metabolic results, because in gastric bypass, we do surgery in the stomach and also in the small bowel, in two parts of the body. When we touch in the small bowel, we are working on hormonal and metabolic treatment. So the gastric bypass, something extra that has the gastric bypass, is the best option for patients that have acid reflux symptoms, GERD symptoms. It's really common. We see really often in our patients. So if you have acid reflux, GERD, esophagitis, the gastric bypass could be the best option, and also it's a great metabolic surgery.
Yeah, you mentioned.
Yes, so we have a sheet here that we compare gastric sleeve versus gastric bypass. So gastric sleeve, we can do it in patients that BMI is higher than 30. In gastric bypass, when patients are bigger, 35 to 55 of BMI, this could be the best option. Okay, as we said, when patient has acid reflux, the best option is gonna be the gastric bypass. When patients are struggling with slower metabolic issues, the gastric bypass is gonna be best option. Patients that do a lot of sweet diet, the gastric bypass could be a best option. And always the gastric bypass is the gold standard for revisional surgery. So a good surgeon must do a good gastric bypass, because I see a lot of surgeons that only do gastric sleeve. All the good surgeons must
able to do, yeah.
yes. A surgeon, a bariatric surgeon that cannot do a bypass is not a bariatric surgeon.
Now, here's, again, we talked about going to a store to buy a jacket, right? One of the things that you're capable of doing is you don't have a limitation of BMI on bypass. Let's say if a patient is 55 BMI, you can still do a bypass.
Yeah.
Where I know some surgeons are very limited. They can only do up to 45 BMI on bypass, right?
Yes.
So if the patient really needs a bypass and they're 55, 60, 54, they're not gonna get what they need. And I always say that it's not like plastic surgery. Plastic surgery, if they mess up your face, you will see it. But if this is internal, you would suffer for the rest of your life, but you don't see it.
Exactly. Yes.
Yeah, so let's talk about mini bypass.
There's another option that is the mini gastric bypass, is the one anastomosis gastric bypass. In the traditional bypass, we have to do two anastomosis, the connection between the bowel to the stomach, and the second connection between the bowel to the bowel. So in mini gastric bypass, we only do one connection, one anastomosis. This procedure has it's less invasive because we only do one connection. It's designed for patients that doesn't have acid reflux. Also, patients that BMI is high. We can give this procedure as a tool, and also it's another version of the gastric bypass. No, it's another version of the gastric bypass. So this is a table chart where we compare the mini gastric bypass to traditional bypass. So also it is a shorter procedure. Patients that have heart disease, lung disease, and we want to make a shorter procedure, this could be an option to make a safer surgery. So, but it still is a bypass. So the SASIS, the single anastomosis stomach ileal with sleeve. This is a new procedure, okay? There are 3 new procedures. This is one of them. We can find it as bipartition, a single anastomosis bipartition. And the idea of this is to do a gastric sleeve without with no cutting the connection to the duodenum, and also we do an anastomosis in the last part of the stomach, that is the antrum, and it's only one anastomosis. This is a new version of the gastric bypass, okay? Because sometimes bypass could be a challenging surgery with so many steps. So this is a new kind of bypass with metabolic results. So that is something new that we are doing this in the company. So it's a new option that we have. We have also the duodenal switch. Duodenal switch is the most powerful tool in weight loss surgery. We have a TV here in the hospital when we have the before and after of duodenal switch patients, and it is amazing how big patients can. It is normal now, and this only happens with the duodenal switch. That is the most powerful tool. But also is the most difficult surgery in weight loss surgery. And here in the company, we are the surgeons that we have the most cases in the world. So we have the most expertise in the world doing this procedure. So this procedure is designed for patients that BMI is really high. This is also a good option after a revision for a revisional surgery after a gastric sleeve, and also patients that have sleep apnea, that have a lot of heart disease. If they need a metabolic surgery, this could be the best option of metabolic surgery, because we preserve a part of the digestive system, that is the pyloric valve. That is something more physiologic. We have less dumping syndromes. We have the quality of life is better. So this is one of the most
the ultimate tool.
yes.
And when we talking about like long term, right? We want this to be long term, not just 1, 2, 3, 5 years, right? So down maybe 15 years, right? We want the patients to be successful, maybe lifetime, right? And also we were talking about why patients should consider the surgery, because it adds average of 10 years to their lives, right? It's so many benefits. Your stamina, you want to play with your grandchildren, you want to play with your kids, you want to be able to do things, be active, be outside, doing, climbing mountains, doing other things.
Enjoy the life.
Yeah, enjoy life. And there's also a stigma in the US, right? When people judge you based on your work. Yeah, so this is actually interesting. Again, you mentioned about
Yes, this is technology. A traditional way to do the connections between the stomach to the small bowel is with stapling, titanium stapling, and also with suture. But the new kid in the field is the magnetic surgery. That's a new way to do connections between the digestive system. The results are really good, with less statistics of complications, less bleeding, and less leaks. So that this is something new that we're gonna do it, because it's part of our evolution of as a surgeon. So this is all the options that we do. We are experts in all of these tools. And we understand that if you have a gastric sleeve, we can do it. If you need a duodenal switch, we know how to do it. We have the experts that understand how to do it, because it's not to do it. You have to do it the best way to do it. So to have
we
better.
talked about that.
Yes.
Yeah. It's not like everyone can do the same gas.
Exactly. And we are experts in all of this. We are experts in all of this.
Revisional surgery.
That is hard. That is hard.
That's hard, yeah. And then most of the doctors and surgeons in US don't want to touch that. That's why one of the reasons patients come to us, right? Actually, this is a good subject. There used to be a time that people hesitated to come to Mexico, Tijuana, right? There was a misconception. Now they're not just coming for price. Our prices are, of course, so for what we do. But they're coming for your expertise like surgeons like you, because the type of revisional surgeries that you do, no one can do. They're not even willing to do because it's so dangerous.
Yes, because you need to understand anatomy. You need to understand the way another surgeon did the surgery. Scar tissue, you need to deal with scar tissue. It's complex, but again, we do this every day. We feel comfortable with revisional surgery. This is like a puzzle. So if you understand the weight loss surgery, you're gonna be able to do revisional surgery. So we can go from Roux-en-Y to a Roux-en-Y gastric bypass. We can go from Roux-en-Y to a duodenal switch. We can go from Roux-en-Y to a duodenal switch. That is the hardest surgery.
That's the hardest surgery.
Yes.
No one can do.
It's really, really hard. We can go for endoscopic to laparoscopic. We can do simultaneous endoscopic and laparoscopic. So we have all the tools. We have all the tools.
That's why the patients come to us.
Exactly. I have doctors that are coming only for revisional surgery. This week, patients send me a message. Are you sure you can do this? Yes, I'm sure I can do that. I can do this because all the surgeons here in the States tell me that it's really hard. That is almost impossible. I'm talking about the Roux-en-Y to the dual switch. We did it this Wednesday. Yes, we always are doing these surgeries. It's the normal for us.
Oh, you may want to mention about like hiatal hernia repair.
Yes, hiatal hernia is another disease that's really, really related with obesity. When the acid of the stomach goes through goes to the esophagus, can have a disease that is the GERD disease. So the hiatal hernia is in the diaphragm, that is a muscle that separates the thorax to the abdominal cavity, and we have to fix it. At the moment we found a hiatal hernia that is really, really common. We have to fix it to not having acid reflux issues. So we know how to do it. We're experts doing hiatal hernia repair. So it's really, really common.
Yeah, you did touch
yes, the
on
PCOS.
getting pregnancy.
PCOS can give you a lot of problems in every month. If you're trying to get pregnant, this is a real common situation, and weight loss surgery can help you with that. It's amazing how they improve their metabolic, the hormonal cycles, and they are able to have a baby.
Dr. Rodriguez, what would be how long does the patient need to wait until they get pregnant?
I think that we need to wait after the complete weight loss process has been done. I believe 1 year and a half is a good time. 2 years, if you check the articles, medical articles, 2 years. But 1 year and a half, it could be a good moment to start thinking in pregnancy after weight loss, because if you do it before, the baby's gonna take all the vitamins, the protein, the bone, because and you can suffer more than a normal pregnancy. So it's better to wait after the weight loss has been done, and then you can do pregnancy.
Okay, so this is actually another frequently asked question. Patients keep asking, when can I go back to work? When can I start exercising, swimming, walking? Some people want to lift weight, heavy weight. What would be the norm to?
Well, if we
to
do
wait?
endoscopic, in endoscopic, we don't do surgery, we don't cut. So you can go back to work 2 days after procedure. You can do exercise 3 or 5 days after procedure. This is something different in laparoscopic. In laparoscopic, we do little incisions, but we need to wait the time of healing. The time of healing is around 2 or 3 weeks in laparoscopic surgery. But after 2 or 3 weeks, you can start doing exercise, but you need to increase intensity every day. You cannot start with heavy lifting. You have to start slow and then increase the intensity of exercise every day. But but you will never be on bed. You're gonna be able to walk the same day of the surgery. Patients can drive 5 days after surgery. All of our patients flight 2 days, 3 days after procedure. You're gonna be able to go walk to a mall 1 week after surgery. You can do office job. Our patients are doing office job in the same day of the surgery. They bring their laptops and they're doing office job. So laparoscopic is really amazing in recovery. So if you do office job, you can go back after 1 week. If you do another type of jobs, probably 2 or 3 weeks after procedure.
And everyone is different, right? We see patients, some patients you see the first day after surgery is like nothing happened to them. And there are some that it takes them a day to kind of come around, right? You basically have to listen to your body and see how you feel. If you're exhausted or, but in general, don't try to push up and lift heavy weight. Actually, we always suggest pack light when you come here because the weather is always nice. We don't have those extremes. And when you go back, you don't have to lift the heavy suitcase. Just be mindful of that. Let's see what else we have to cover. We already talked about that. Now, the hospital there is giving us so much more capabilities of giving you services you need. For example, plastic and cosmetic surgery. We have the best post-bariatric plastic surgeons that are not only board certified in plastic, they also know how to deal with post-bariatric patients. Maybe you want to explain what's the difference between doing a plastic surgery, let's say a tummy tuck. The mummy makeover is one of the best, most popular procedures we do here. Maybe breast lift or arm lift or tummy tuck. What would be a difference between a surgeon who has experience with post-bariatric patient and who doesn't? What makes a difference?
Well, after a weight class, your body is gonna change a lot. And when you lose the weight, probably you have to, the last part of the treatment of weight loss is gonna be the plastic surgery. Because at the moment we see, they see the body after a plastic surgery and you have the before and after. It's amazing the face of our patients when they look in the mirror after all the journey that they had. The plastic surgery must be must be the last treatment of the weight loss surgery. It's something that you will need to have the complete success, because at the moment you look to the mirror and you say, that's the person I want to be. I saw they cry because it's okay to lose weight, but you need to remove that skin, extra skin. So, but you have to do it with that expert after weight loss surgery, because it's not gonna be the same. The skin is different, the muscle is different.
Thank you.
The supplementation that you will need for after the plastic is different. So it's a totally different patient. It's not a common patient, because again, expertise is the difference. Expertise in difference, and your body pass for a lot of things with the weight loss that the plastic surgeon must understand what are those change. And the moment they understand, they will know how to do the best surgery for you. But plastics must be the last part of the treatment. That's
And the same thing, like you mentioned, for pregnancy, they need to wait 1.5 to 2 years to get to their ideal weight and then do pregnancy or go for plus.
Yes. Yes.
And then we do hybrid procedures, like I mentioned, we've been doing endometriosis, which is the very difficult surgeries, hysterectomy. We could do this in combination with sleeve,
Yes, exactly.
And then orthopedic, we've been working on starting a program with knee replacement, hip replacement. Of course, when you're heavy all your life, you probably damage your joints.
Yes, the pressure, the weight that your joints are for sure they can have it's hard for your joints to maintain that weight. So sometimes they need to treatment for the knees or the hips, so to be able to walk, to have a better quality of life.
And last but not least, regenerative medicine, stem cells, exosomes, peptides, these are for any ranging from anti-aging well-being, very simple IV injections to more complicated stuff like a joint, whether it's a spine, knee, shoulder, and diseases like Parkinson's disease, type 1 diabetes and all that. Okay, so we got to the end of our presentation. There are just wanted to touch base on financing. There are several companies we work with, but you could also go to your credit union or your bank looking for loans. Just make sure you don't apply for too many loans at one time because you're going to hurt your credit score. But we can consult with you what is the best option for your financial situations. But we do have a lot of different ways that patients pay us. The best way that we see is they pay the deposit and they bring cash or check with them. Please make sure you tell your coordinator how are you going to pay 15 days prior to the surgery, so we don't have to worry about payment issues, and we will be focused on your healthcare when you come here. We have this extraordinary offer for our patients, which is a coverage, what we call MTI, Medical Tourism Insurance Coverage. They buy this for $99 and it offers coverage for complications, different, interruption to your travel because of complication. As you see, is a great thing to have for peace of mind.
Yes.
Our nutritional program before and after is what makes you successful, and we strongly suggest bariatric vitamins. We have Emerge Bariatrics vitamin because this is the thing. People think that they can take multivitamin post-op and it would do the job, but as you see, the ASMBS requirement, you see there are so many different of the ingredient you need to take more or less.
Exactly.
So this gives you exactly what your body needs. What is the risk of not taking vitamins down the line, 7, 8 years, 10 years?
Your energy, your hair, your skin, your blood, anemia. You can have visual issues with the vitamin A. There's a lot of risk. Your bones, exactly, your calcium. So you have to do bariatric grade supplementation. They already exist. We're going to give you all the information. We're going to give you a recommendation because we know what are the doses that you need, and that's just follow instructions. If you follow instructions about vitamin supplementation and protein supplementation, you will be okay.
Actually, that's a good point because their journey really starts from pre-op, right? Why is pre-op diet so important?
We have to, we're gonna manipulate your stomach, and the food is gonna goes through your stomach. So we need to put your stomach on rest. But something important is to shrink your liver. The liver is the organ that is designed of to control the metabolic part that is coming from the food. So we need to put on rest your stomach and your liver. The stomach is under the liver, so if we control the size of the liver, we can have a better surgery. You can get inside of surgery with a better metabolic control, with a better blood pressure signs, with a better glucose levels for surgery. So we want to reduce the risk of the surgery doing a good pre-op diet.
Okay, so I just released what we call a Zoom poll. So we need you to answer a few questions that we have there to get a clear idea of how we're doing, what are the suggestions you have for us in the future, and just get feedback. So let's go to the questions that our patients have. Let's see, we already have 53 questions.
Okay.
Okay, let's start. Okay, Zoom poll I just released. Oh, what antibiotics are you using for the surgery?
Well, we have the traditionals, but if you are allergic to some antibiotics, we have all kinds of antibiotics. But what we use traditionally is ceftriaxone for to prevent infections of the surgery.
So they're asking, what is your complication rate in the last 12 months as far as leaks, bleeding, requiring reintervention, DVT, and reoperation? So first of all, what would be the most complications when you see when they're here?
I believe bleeding. Bleeding is the most common complication. That's why we use drain tubes. That's why they stay with us after surgery. Those companies that do 1 day surgery, and they bring the patients to another house the same day of the surgery. That is not okay. You must stay in the hospital to check there's no bleeding. If there's a bleeding, we know what to do. We have our team ready to those complications, but it's part of the surgery. A bleeding is part of the risk of all the surgeries in the world, and also we have it in weight loss surgery, but it's really, really, really low.
And how many times do you need to do reintervention? Because like a few weeks ago, if you recall, there was a patient that was bleeding,
I believe
but you took care of it with just medication.
We can control bleeding with medications, transfusions, but sometimes we need to go back to our surgery room. I believe we have to go back to our surgery room every 2 or 3 years. That's really, really
That's
low.
very low.
Very,
yes.
very low.
Yeah, now we have an option for companion to stay with you when you're in the hospital or stay in our hotels. We're using Hyatt and other hotels if Hyatt doesn't have room, but that's the option you have because some patients feel safe for their companion to stay with them.
Yes.
Even though they're safe here, right? We have nurses, we have coordinators, we have you guys, you have your team. That's something every surgical team is independent, right? You have your internist, you have your
Anesthesiologist.
instrumentation, anesthesiologist.
Okay, so perfect. These are just So these are not, that's good, because most of them was, okay. How likely is it possible for gastric sleeve to fail?
Well, if you are really disciplined, if you are gonna do your diet and your exercise treatment, and also gastric sleeve, I can say it can be 100% success with the gastric sleeve. But if you ask me, the traditional statistics is 80% of success. But if we are really, really disciplined, it can go to 100% of success.
They're asking, how do you manage pain immediately after surgery?
We have IV painkillers. We try not to use medications that works on the digestive system to have complication after surgery, but are opioids. But if some patients can are really did not tolerate the pain, we can do opioids, but we try not to do those medications, but because they can stimulate other parts of the small bowel that we don't want. So
Maybe talk about the psychological effect of patients in the recovery, their attitude. If they're too anxious, does that help? Or what would be a good attitude for patients to have a good recovery?
well, you must understand that you're gonna have a surgery, and to be able to do a surgery, we need to cut. It's gonna be a medical cut. Everything's controlled, but it's something invasive. So if you are if you know that this is gonna happen, that it's normal to have a little bit of pain. And it's not a painful surgery, it's more pressure because we use gas to inflate the abdominal cavity. We cannot remove the 100% of the gas when we finish surgery, and you're gonna feel that gas as pressure, a pressure pain. But you must be focused, and you must be relaxed 2 or 3 days because it's part of the surgery. We're gonna take good care of you. We know what we're doing, but we understand that if some patient is the first surgery and they are really, really nervous, really, really anxious, but you must trust
Yes.
yes, and we're gonna take good care of you. We know what we're doing. We have all the medication that you will need, but I know it's hard. It's hard to.
Yeah, so at the end of the day, it is a surgery, but they're getting this surgery with the best of the best.
Exactly.
That's what they need to do.
Yes.
And I always tell them, it's okay to be anxious, is nervous, but don't be too nervous. I don't think being too nervous is help the recovery. I see patients the first day, they feel like there's something happening to them. That fear keeps them not being able to recover.
Because with anxiety, your blood pressure can get higher, your heart rate can be different. So it's better if you are calm.
So what type of food do the patient usually have problem after surgery, and what kind of emotional changes happen after surgery?
Well, there's a lot of emotional change because we're gonna change the hormonal part of your body, and your body communicates with hormones. So you're gonna smell different. You're gonna taste, the food is gonna taste different. You're gonna be at the first week or the first 2 weeks, your energy is gonna be a little bit low, but yes, you will have a lot of emotional change, but it's only temporary. As after 3 months, you're gonna understand how's everything working. You're gonna understand how's your new stomach working, and you're gonna feel more comfortable. But yes, it's a change life procedure.
Now, you mentioned about ESG, which is the endoscopic gastric sleeve. what is the criteria? What is the BM requirement? What's the BMI? Can anybody with the BMI maybe of 45 get ESG?
We can do ESG, but to have good results, a BMI from 27 to 32 is going to be the best BMI patients to have great results, because if your BMI is higher than 40, probably you will need a bigger tool. So I believe 25 to 32 BMI patients is the best number for ESG.
One thing I usually mention is pre-op, taking care of your medication pre-op, right? We don't want them to take NSAID, any blood thinner 1 week before, right? You give them instructions, of course, through our surgeon liaison to say, hey, these are the medication you need to stop, and this is what you have to, this is when you start, right? Like if they're taking something for anxiety, for example.
Anxiety, blood clots from diabetes, from high blood pressure. We know a lot of our patients are already using medication. To just give us all the information to your coordinator.
Yes, make sure you,
Yeah.
when you fill out your health history, make sure you're giving us all the information
Yes,
about
that's
that.
the clue. That's the
Yes.
most important part, to give all to have a good communication with your coordinator, and you will have no problem.
Now, let's see if somebody signed up for a bypass or sleep came here, you still talk to them, or you just give them the surgery that they signed up?
No, we can talk before surgery. We can, a lot of our patients still have some questions. If we talk and we decide that there's another better option for you, we can change.
So basically, the last minute you can change, basically you're giving them what is best for them, even to the last minute you talk to them, you consult.
Yes, because we want the best from our patients. So yes, of course.
They're asking, is there any medication that we should avoid for long-term success?
To be avoid for long-term timing.
Yeah.
Well, when they're using GLP-1 medication, we tell them to stop.
Yeah, GLP
Stop,
medication at least 2 to 3 weeks if
what
they're
else?
on the GLP-1.
We have patients that have arthritis, that have lupus, that are in a different treatment with a molecular treatment. Sometimes we need to do modification, but just again, you just must give us all your information before surgery, and we're gonna give you all the modification that you must do before surgery.
So, what would be,
Should I clean this up?
Yeah, then we have to just. Unfortunately. Okay.
so what would be, what signs would they be looking for if they actually have complications?
Okay, fever, pain. It's normal to have a little fever the first 2 or 3 days, but just one, a little fever, vomiting, and the pain that doesn't improve, that is increasing. There are the signs that you must be in contact with us.
They're basically asking, what do they need to do to be successful? What makes a surgery successful?
To choose the correct tool, the correct surgery, and also to be really disciplined with the diet and exercise.
Starts with pre-op diet, right? From the pre-op diet, that shows their commitment to this life-changing procedure. This is a life-changing procedure.
Yes.
So what type of aftercare they need to do? Because some patients ask, do I need to come back to Mexico, or what do I need to do?
Our patients always have an aftercare doctor that is going to be in contact with them. You also have your coordinator with you, and we also can be in, if you want, if you have some questions, we can do messages, we can do video chat, we can do here in the webinars. We're always in contact with all of our patients, and you always have a cell phone number that you can contact us. So it's really, really easy with technology to be in touch with us.
So this patient is asking, I had sleeve before and I picked up 30 kilograms over 5 years. What would you say is best surgery for me? And
Well, we need more information, but the two options that you can have after gastric sleeve is a Roux-en-Y gastric bypass or a duodenal switch.
so they're saying, what do you guys do?
With the vagus nerve. Okay, we in weight loss surgery we can find the vagus nerve in two situations: near to the esophagus, but we don't touch that part of the vagus nerve, and also there's some selection nerve situation that we can find during when I really near to the pyloric valve. Also in Roux-en-Y gastric bypass, the nerve that is through the stomach, we have to cut it in the Roux-en-Y gastric bypass, but that's the only situations that are we are in contact with the vagus nerves, and we don't try to touch them.
So it's interesting, we mentioned about GLP-1 medication. Yolanda is actually sharing with us that she was on GLP-1. She gained more than what she lost. And, you know, she doesn't want to do the rest of her life. The insurance doesn't cover it anymore. And yeah, so I mean,
We have many.
they call them GLP-1 trap, you know, because you get in there and you have to take it. It's, you know how much money they spend these pharmaceuticals to promote this, you know, in advertisement, going giving the doctors, you know, incentives to actually prescribe that.
The pharmacy is it's a business. It's a business pharmacy.
Yes, it's a huge market right now. So let's see how we're doing with time. Yeah, we are almost 1.5 hours. Again, you guys need to share your health history the best you can with us. And these doctors have done so many different cases. They recognize what type of patients you are, what is best for you because of your experience, right? You've done how many band to sleep, for example, you've done, or sleep to bypass, or sleep to DS. You have so many cases.
A lot.
There's no expertise like you in the world, I would say. They're asking, do you recommend IV treatment for nutritional supplements?
It is not necessary because weight loss surgery is designed for to be able to do oral supplementations. But if you want to do it IV, it is okay. Just not contraindication. It's not necessary, but if you want it, for sure you can do it.
Okay, so why is it that the patients shouldn't drink 30 minutes before meal and 30 minutes after meal?
Okay, the stomach has three parts: the fundus, the body, and the antrum. The fundus is the part that was originally designed to control the liquids. So that is the part that we have to remove. So we have to remove that part of the sleep to the stomach to perform a sleep. So that is why you have to do it first, the solids and then the liquid, because the part of the design for that to control that is not anymore.
There's just a lot of, because we've been talking about complications, a lot of questions about complications. They're asking like, what's the chance that the staple will be open?
The chance is, the number is 0.08, but our numbers are like 0.004, are really, really low.
But you also do reinforcement.
Oh, yes, yes.
Over the sleeve.
Yes.
You want to talk about that?
Yes, reinforcement is a safety craft that we do. We spend more time doing reinforced than the sleeve. We believe that we spend that time is gonna give you a better and safer procedure, because we are reinforcing the staple line. So we do it, it's a hand technique. So we believe that is part of the safety in weight loss surgery. So we always reinforce all the staple lines. All the staple lines are reinforced in all of our patients.
Now you want to talk about how important is your team to you, your anesthesiologist, your assistant surgeon?
To be able to do surgery, weight loss surgery, we need to understand how obesity patient, or a big patients, or a patient with heart disease, a patients with lung disease, that physiologic part of the body, we need to understand very well. So the complete team has to be in the same communication, with the same expertise, with the same acknowledgement of the body of our patients. So it's really, really important. I can if I don't have my anesthesiologist, I can do the surgery, because the anesthesiologist is gonna be in charge of the heart, of the lungs.
Yeah, but they also have, is there a cardio anesthesiologist, right?
Exactly.
They're not a normal
No.
anesthesiologist that just graduated from school. That's what enables you to handle these cases that no one else is willing to do.
Exactly. Our nurses, to do an IV in obese patient is harder than so our nurses can do an IV puncture at the first in the first intent. So everybody is expertise, and we need a complete expertise team.
So our nutritionist is sending you the pre-op, post-op. She also does webinars. So if you have questions, you can always reach her by phone, text, email, and she does webinars. So I recommend you get on those webinars, sign up, because you will be talking about what is the best way to do pre-op? What's the best way to do post-op? Because these are huge, right? We talked about what is a success, what is a combination of the best successful surgery, right? Pre-op, post-op, your lifestyle changes, being active, even just walking, right? Just be active.
Yes. Movement.
Movement, yes. You get a lot of because we've been talking about complications, yeah. Yes, age, what is the age factor?
Well, our oldest patient is 84 years old. Our youngest patient is, I believe, 16 years old. 16 years old. Yes, age is important, because in that moment of your life, if you are in the 80s or in your 70s, you need different things. So we try to fit the surgery for what you need, and the age is really, really important. Sometimes we cannot be too aggressive if you are in the 80s or in your 70s. So yes, an age is part of factors to make the surgery choose better.
Is surgery reversible?
Well, the gastric sleeve is not reversible, because the part of the stomach, we take it out. The Roux-en-Y gastric bypass, it is reversible. The endoscopic sleeve, it is reversible. The balloon is reversible. The duodenal switch, Just one part is reversible, that is the duodenum part, but the other part that is a gastric sleeve is not reversible.
Now, they call gastric sleeve is it SMART, right? Patients sometimes ask, can you remove less of my stomach? Is this a factor, or should you consider cutting less or more?
Yes, it could be an option. Again, if you want to do a surgery designed for you, sometimes we can do this because everybody's stomach is different, the size is different in all of our patients, and yes, we can do that.
Now, Maria is asking in Spanish,
So María dice, ¿puedo dar información sobre la cirugía de SADIS en español? Sí, claro que sí. I'm going to do it in Spanish.
Sure.
So, the SADIS es la cirugía más poderosa que existe en la bariatría. El SADIS consiste en hacer una manga gástrica, un gastric sleeve, y la combinación con un bypass, pero el bypass se hace en una parte muy poderosa que es el duodeno. Esta parte tiene muchas conexiones nerviosas, que es como el plexo solar, y además preservamos una parte del cuerpo que se llama píloro. El píloro es una válvula natural y es otra cosa que preservamos en el duodeno switch. Es por eso que es la cirugía más efectiva para el control de peso y el control metabólico.
Talk about gallbladder. You know, some patients need a gallbladder removal, and you do remove it during surgery, or maybe some patients don't have gallbladder. Is that a problem?
Well, if you don't have a gallbladder, for sure we're gonna find scar tissue, but we can handle that. There's no problem for us. We understand it's part of the of this of doing revisional surgery. But if you have gallstones, if you already know you have gallbladder issues, we can do it simultaneously with the surgery, with the weight loss surgery, and we can do gastric sleeve and also remove your gallbladder. So yes, it could be part of the plan of the surgery.
Oh, that's a good one too. GERD and reflux. Does it get worse with gastric sleeve? What is the factor?
Well, in gastric sleeve, we're gonna change the pressures of the inside of the stomach. So yes, if you look at statistics, if you do the research, you will find that the 15 or 20% of patients with gastric sleeve can increase the acid reflux. But again, if you choose an expert surgeon, they will look to if you have a hiatal hernia. If you have a hiatal hernia, if you fix it, you can improve your acid reflux. So it will depends on findings. It will depends on the way a surgeon performed the gastric sleeve. The gastric sleeve must to be tubular. Geometry is something important in gastric sleeve. So it will depends of the way we do the surgery to have less incidence of acid reflux. But yes, the answer is yes. To 15 to 20% of our patients can increase the risk of acid reflux.
What's the best way to deal with gas after the sleeve or any procedure?
The gas pressure pain, walking.
Yes.
Walking is the best you can do because there's no medication that can take out the gas. It's something mechanical. If you walk, the gas is gonna move up and you're gonna breathe out that gas. So that is why we wake up our patient after 2 hours of surgery, and we tell them that they need to walk. It's really, really important.
No, I didn't mention specifically what's the pre-op diet, post-op. Pre-op diet is based on BMI. If your BMI is high, then you need a few weeks of pre-op diet. If your BMI is close to 30, you probably only need a 2-day clear liquid, which we all need to do prior to surgery. Very simple. But again, stick to that. Post-op is a four week from going from
From steps.
liquid
Yes.
to solid. And this is, again, very important. So how soon can they stop their diabetic medication, like metformin?
This is something amazing with metabolic surgery. We have patients that at the moment we do surgery, they don't need medication anymore. But there's in other situations, patients must do the blood test with your primary doctor. But I believe after the first 3 months after surgery, the 80% of our patients are out of diabetes medication. That is something impressive, amazing, amazing. That is something that I love of weight loss surgery.
So we have like, how many more? We have quite a bit of more questions. I don't want to keep you and everybody else more than about 45 minutes. We're gonna announce the winner for a raffle. And again, if you didn't hear your questions answered, circle back with our office, with our coordinators. All of our doctors doing a live on Wednesdays, 10 a.m. There are so many ways to reach us. Of course, we take turns. Dr. Rodriguez, I don't know, when is the last time you had the live? Maybe a few weeks ago.
2 weeks ago.
2 weeks ago. So probably you'll be back again. Again, look for us 10 a.m. Pacific Standard Time on Facebook Live. Look for all of our webinars. You can always call us, contact us. And we'll be more than happy to answer your question. So I'm going to announce the winner of the okay, Chris.
I have to leave right
Yes,
now.
thank you so much
welcome.
for coming. It was a pleasure.
Thank you guys. See you next time. Anytime you have questions, just send a message.
Yeah, thank you so much.
Welcome.
We appreciate you. Okay, so Crystal Ibarra is our winner. I'm going to let you talk and just share your history and your story with us. Thank you, Dr. Rodriguez. Hi, Crystal.
Hi,
How are you?
I'm good. I have been looking at getting weight loss surgery for I would probably say 4 years. I've been following you guys for the last 3 years nonstop, but I just pull it off and put it off. I'm like, oh, I can do it on my own. Oh, I can lose it. And I think I finally got to the point where it's more like I just plateau at one weight and I don't move from there. And I'm like, I need help. Something I've tried every diet you can think of. I've even done Ozempic to the point where I lost 30 pounds, but after that, I didn't lose it. It felt like my body was getting used to the medication. And I was very like hormonal. I was always angry. It was never it was different. I just wanted I'm now wanting to do it more than ever. I've been looking at it for consistently within the last month or two. Um, I'm just really excited because I am going to schedule within the next, I want to say, I was talking to Jamie, and she's very, very like, I don't know how to say it. She's very consistent on, hey, do you have a question? Hey, do you need this? Hey, by the way, this is what's needed from you. And I've been looking at the webinar that you did last month. It was very informational, but this one today, I felt like there was a lot more details that were answered, questions that I didn't even know I would even ask, but there was a lot more answered. I'm 38 years old and I feel like I need to change. I have no more kids. I have one and done. I just need I feel like my bones are starting to hurt. Like I'm getting into that age where I need to be more healthier. So I'm taking the leap and actually going through with this. I was very skeptical because I've heard a lot of don't go to TJ, don't do this. That's look into something else. And I've been doing a lot of research. There's other places in TJ that I've also looked at, but I don't know what keeps me coming to this one. It could be just you have a great staff that, continues to reach out. You guys got a lot of informational videos out there, and it kind of just draws me. But I'm actually so excited that I actually won because I never win anything.
Yeah, welcome. Where do you live?
I reside in San Diego, California. I am actually away in San Antonio, Texas right now. I had a family emergency with my brother. That's totally unrelatable to anything, but I'm only here for a couple of days, maybe about a week or so, and then I'll be heading back but I'm originally from San Antonio. I'm originally from San Antonio, Texas, but been residing in San Diego since 2014.
We're great. So again, congratulations. Regardless, you guys are all winners because you're taking action and making the changes in your life. And again, this is a life-changing procedure, life transformation, and it's so many benefits. I see patients that sometimes hesitate, they worry about complications, about what happens to my stomach and this and that. But this is a great step in taking your life back. Well, Crystal, thank you. Again, thank you, everyone. We appreciate you to put your trust in us, and we will see you down here.
All right.
We'll
Thank
see
you
you
so
next
much.
time.
Thank you.